Welcome everyone to today's virtual overview of Scrutiny Committee hosted by Bassetlaw District Council. Given the current challenging situation we all face following the outbreak of COVID-19, new legislation has been approved that enables councils to host virtual meetings rather than requiring members to be present in the committee chamber when making a decision. This keeps everyone safe by maintaining social distancing etiquette and allows business to be conducted in an appropriate manner. It is very important that councillors can hear each other, so I'll invite members in alphabetical order to confirm their attendance and in so doing test their broadband connection. So Councillor Jack Bowker.
Councillor Bowker, present, Chair.
Thank you. And Councillor Lynn Schuler is subbing for Councillor Robin Carrington-Wild.
Good evening, Chair.
Thank you, Lynn. Councillor David Challoner.
Present, thank you, Chair.
Thank you, David. Councillor Ant Coulter, I think, might be late.
He's not joined the meeting yet, Chair. Thank you.
Thank you. And Councillor Deborah Merriweather.
Here, Chair.
Thank you, Debbie. And Councillor Neil Sanders is subbing for Councillor Nash.
Good evening, Chair.
Thank you, Neil. Councillor Claire Plevin.
Good evening, Chair.
Thank you, Claire. And Councillor David Presley.
Yes, here, Chair. Thank you.
Thank you, David. Councillor Madeline Richardson.
Here, Chair.
Thank you, Maddie. And myself, Councillor John Shepherd, as Chair. Councillor Helen Tamblin-Saville.
It looks as though she's frozen, John.
Looking at okay. Yeah, it looks as if she's frozen.
It does, yep.
Frozen in time.
If you want, continue, Chair. Yeah.
I'll come back to Helen. Councillor Mark Watson.
Yes, present, Chair.
Thank you, Mark. I'll just try Helen again. Councillor Helen Tamblin-Saville, can you hear us? So she is present, I believe, but is having some difficulties.
Yeah. Hopefully she can rejoin shortly.
Yeah. I think we'll push on there. I'm just going to introduce the key officers by doing a roll call. So first of all, Linda Dorr, meeting facilitator.
Present, Chair.
Thank you, Linda. And Stephen Brown, Head of Corporate Services.
Good evening, Chair.
Thank you, Stephen. Richard Gadsby, Policy and Scrutiny Officer.
Present, Chair.
Thank you, Richard. And Liz Whittles, Policy and Scrutiny Officer and Clerk for the meeting.
Present, Chair.
Thank you, Liz. Also in attendance from NHS Bassetlaw CCG is Idris Griffiths, Chief Officer.
Good evening, Chair.
Thank you, Idris. And Dr. Victoria McGregor-Riley, Deputy Chief Officer.
Good morning.
Thank you. If a number of members lose connection and the meeting becomes inquirate or live streaming for public viewing fails, I shall have to adjourn the meeting for 5 minutes to allow connection to be re-established. Given that this is a virtual meeting, there is no corporate responsibility to detail a fire procedure as we ordinarily would. However, I'd like to highlight that this committee is live streamed on social media, so all participants, please be aware of your actions and take appropriate safety precautions from your place of live streaming. And can I please remind members to switch off their microphones when not speaking. Agenda item 1 is apologies. We've got any apologies?
Yes, we have received apologies from Councillor Robin Carrington-Wild and Councillor Lynn Schuler is the sub. Councillor James Nash has sent his apologies and the sub is Councillor Neil Sanders. We've also received apologies from Councillor Ant Coulter, who is hoping to join us later. Thank you.
Yeah, thank you. Agenda item 2 is to receive declarations of interest by members and officers. I don't think we've received any.
John, just for clarification.
Yes.
I work for Doncaster and Bassettlaws teaching hospitals. The mental health services aren't provided by them. They're provided by the community trust. So presumably I don't need to declare an interest there.
Mark, I'll just defer that to perhaps Steve Brown.
That would be right, Chair. The connection there is so remote that there would be no direct or indirect pecuniary interest arising from that, as far as I can see.
Okay.
Can I just check, Chair? Is that the same for myself? I believe it is, because I only work at Bassettlaw Hospital and don't have anything to do with mental health services.
Charlie Williams' dad Rex died in a care home, but he still.
Yes, that would be my understanding as well, Chair.
Okay. If members or officers do realise that they have a pecuniary interest, then do declare that as soon as you realise that. Agenda item 3 is minutes of the meeting held on 23rd of February 2021 on page 5 to 12 of your agenda. You all had a chance to look at these already. Is any member not in favour of the minutes? No, thank you. The minutes are therefore approved. Agenda item 4 is minutes for action and implementation list on page 13-14 of the agenda. Are there any questions from members? No, thank you. Item 5 is outstanding minutes list, page 15 of the agenda. Are there any questions from members? No, thank you. So moving on to item 6, and for this we're joined by Idris Griffiths and Dr. Victoria McGregor-Riley from the NHS Bassettlaw CCG. Members will note that Overview and Scrutiny Committee can undertake scrutiny of local health services from time to time. Last year, we were advised that a new model for urgent and emergency care at Bassettlaw Hospital is being considered by the Clinical Commissioning Group, or CCG. And therefore, we agreed to ask the CCG to attend the committee to provide an update on services in Bassettlaw. We also understand that the CCG are looking to transform mental health services locally, so we would also like to hear about these proposals. Can I remind members that we are now in the purdah period leading up to the May elections. Members must therefore refrain from making any political comments in any questions or observations that may be arising from the presentation. So I'm now going to hand over to Idris Griffiths, Chief Officer of NHS Bassettlaw CCG, who's kindly agreed to provide the updates. Over
Thank
to
you, Chair. Thank you, Chair. Good evening, committee. I could do this through a short presentation, if that would be helpful, Chair. There's nothing new that we haven't already circulated, but perhaps it will just help us highlight some of the key points. If
yes, I
think that would be helpful.
Thank you.
Could someone just confirm you can see that first slide, please?
Yep, I can see that. Thank you.
Excellent. Thank you. So as you said, the last time we met, we spoke about two things. One was transformation around the urgent care, the front door service of Bassetlaw District Hospital. That was facilitated by the promise of significant capital investments into Bassetlaw District Hospital's urgent care service. That capital investment hasn't yet been received, and so the engagement period that we'd timetabled in has meant that we've had to set aside that development. So I'm more than happy to talk about the plans for that, but at this point in time, we're not in a position to continue with formal engagement around it, or indeed its implementation, but hopefully we'll be able to bring news of that before too long. So what we've had to do is concentrate our current engagement exercise on the other elements, which is transforming mental health services in Bassetlaw. There are two aspects of this, as I'm sure members of the committee will be aware. There is, in one part, significant investment that the CCG is putting into local mental health services. And so the first part of the presentation covers some aspects of that investment. The second half, which I'm sure members will be sort of interested to discuss, is with regard to the future of the inpatient mental health beds based currently in Bassetlaw District Hospital. So if you'll allow me, I'll split the presentation to those two halves, and then happy to answer then any questions and any queries that you may all have. So first of all, our ambition, which I think is sort of long stated from a clinical commissioning point of view, is to improve the care for the patients of Bassetlaw and for the wider public. From a mental health perspective, there are several aspects to this. There's the development of increased community care, and that can be through Nottingham Healthcare Trust, who's the main provider of the mental health services in Bassetlaw, or indeed it can be through various other organisations, and we invest and will be increasing our investment in local community and voluntary services, many of whom provide invaluable support to the wider public with regard to some mental health and the associated issues that can be a driver and a cause of mental ill health. Secondly, to support people with improved self-care. That's partly linked with some of the community voluntary service as well, but better information, better support for individuals. And then finally, the issue of hospital care. Like I say, the second half of the presentation, I'll focus on that. So all this is about improving personal health, and well-being for the public of Bassetlaw. Over the next 3 to 4 years, and this investment has already begun this year, we aim to invest more than £4 million into Bassetlaw-based community services. That covers the range of issues that I've just described, and 4 particular objectives. We want to develop 3 local community hubs around which we will base increasing community-based mental health support. Secondly, services wrapped around individuals. So we're designing the services and the support not around operational departments and things, but actually holistic services around the individual to meet all of their associated needs with mental ill health. Fourth principle about no wrong doors is the public can find any of the health services quite complex sometimes. They can sometimes enter into one part of the service and then have to leave to come back into a more appropriate area. What we want to do here is have single points of access, single assessments, and a team that wraps around the individual. So at whatever point they seek that help and support for their mental health, it will be the right point, because we will then seamlessly channel the support around the individual. And fourthly, more money. Resource, I think, for mental health has been recognised traditionally within the NHS as being underinvested on for many, many years. We've now established nationally the principle of parity of esteem between mental health and physical health. But also we have a mental health investment standard that the CCG is committed to achieving. And that is what will help provide the additional significant money of the £4 million over the next few years. So the type of areas, and this is all included in the engagement information that has been distributed, just to give you sort of an idea of the range of supports that this will improve. We will invest in specialist mental health services to support new and expectant parents. So that's perinatal pressure and mental health that is sort of sadly quite common. And the significant investment, the significant support that is really needed to help people through sort of that period. Also, we know that in particular children and adolescent mental health is worsening. That was before COVID. And we are already seeing impacts, both in terms of the numerous lockdowns and sort of the lack of social contact, the lack of structure, the lack of being involved in that formal education has had a significant impact on children and adolescent people. And we wish to increase the support both in communities and local community-based schemes and schools in order to provide additional support. That does include people suffering from eating disorders, and sadly we've seen an increase in the country of people suffering really quite severe impacts around eating disorders, and we want to try and get ahead of the development of when it becomes so serious that people require hospital admission. So earlier intervention and greater wraparound support. Our Iap services, I won't go through every single one of these, I'm conscious of time and to provide everybody an opportunity to have their input, but I'll just go through a couple more and then move on. The Iap services that we receive in Bassetlaw are very, very strong services. We've had this provider now for some time. It's a different provider to Notts Healthcare, and they have consistently met the waiting time standards of the targets nationally. So bucked the trend really of a lot of other places in the country, and we've been very pleased to see that they have been able to sustain that even through the increase in demand that we've seen during COVID. And sadly, suicide has continued in Bassetlaw, and we've had sort of a number of very sad incidents over the last couple of years of both younger and older people. And we know that there are particular issues, for example, with regard to young working age men. And we've recently invested small grants, but I think very well targeted in community voluntary services to support that. But that's part of a much wider level investment. So I'll just move on. Unfortunately, Julie Atfield couldn't make it today, and Dr. Atfield did meet with the leader of the council and has met with Nottinghamshire County Council as well previously. And in her absence, I just thought I'd put a quote by her. Julie's worked in mental health services for many years, nursing background, and very committed to the development of improved mental health services. And she has very much welcomed the significant investment that we're being able to put in to Bassetlaw. So I'll just pause there, if I may, Chair, just to give my colleague Victoria McGregor-Riley a chance if she wishes to add anything with regards to sort of the broader investment, and then I'll move on to talk about the mental health services as inpatients in Bassetlaw Hospital. Is there anything else you want to add, Victoria?
I don't think there's anything specific, Idris, except just to note that obviously really broad range of services that we have invested in that really does provide that, as you said, wraparound service for patients. And we're particularly concerned, aren't we, around children and younger people, particularly as a result of COVID, and also those wider aspects of social isolation and loneliness that's been brought about as a result of COVID. And I think, you know, the wider transformational agenda in its totality really does offer that wider opportunity for us to support people better in their own homes and help them self-manage themselves with their carers and families as well. So it's a journey that we're on, working with our community as well. So, for example, the mental health collaborative that's been set up, really starting to engage with our local community organisations and their representatives to help co-design these initiatives as we move forward. So I just think it's really important that we recognise that we're still on the journey of development and transformation, but we definitely want to do that in tandem with service users, carers and our wider community organisations.
Thank you, Victoria. And obviously earlier intervention and sort of wraparound community support is to try and ensure that people's mental health doesn't deteriorate to the extent that they need admitting. I joined the health service just over 31 years ago. My first post was based in a large mental health psychiatric hospital, which catered for very significant numbers of people sort of in its prime. And so the move to more community-based services is a very long-standing one. And I think there's still a little way to go on that, but particularly around not reducing capacity for inpatient beds, but improving the quality of the inpatient beds, and also alongside that to invest in the community-based services and the early intervention that we've just spoken about. The engagement process that we're currently undertaking obviously will close during the PERDA period, and so a decision won't be finally made until after the election, and that will be taken by our governing body. But just to say, so far, in terms of the wider investment and the areas that have been proposed for that investment, so far that has been very well received, and I think people are very sort of keen to see that come to fruition. But then if I move to the mental health beds issue, we have two wards at Bassetlaw District Hospital, one that provides adult mental health and the other that provides mental health services for older people, and that does include sort of dementia where required. So B2, the adult mental health ward, is 24 beds for adults, so over 18 but under 65. B1 is a 15-bedded ward for older people, and that is split into caring for people with mental health disorders, so those that have, for example, dementia and other organic mental illness. So it's quite a broad range of conditions that people may have in those beds. Each year there are around about 100 admissions into both of the wards of Bassetlaw patients. That's over a year. And that's averaged out over just the last few years, so it's a fairly consistent number. Between 5 and 9 of the beds on B2, so those 24-bedded units, are from Bassetlaw. So therefore the majority are from out of the area. Most of those are from elsewhere in Nottinghamshire, so further south. And of those in B1, we see typically around about half of those patients being from Bassetlaw residents, and the other half, again, predominantly from elsewhere in Nottinghamshire, but some over into sort of Derbyshire and small numbers sort of further north from Rotherham, for example. But the unit itself, consisting of those two wards, is very much a specialist facility now, and therefore it's the geography which patients come from to that type of unit is much larger than a district general hospital, and indeed most district general hospitals do not have inpatient facilities, and as you noted right at the beginning of your meeting with the declarations of interest, these wards are not run by the district hospital, they are run by Nottinghamshire Healthcare, and obviously as Notts Healthcare they cover a much wider sort of population base. So why are we reviewing these services as inpatients? First of all, access, and I know we'll probably talk, I'm sure, about concerns in terms of distance and travel, but there are other aspects of access. For example, getting the right level of therapeutic and recovery services, and we just can't provide all of the really specialist facilities on that site. So we're dealing with obviously people who are quite acutely mentally unwell, but we cannot deal in those 2 wards with those that really need very specialist treatment. So they are already transferred elsewhere within sort of Nottinghamshire. Secondly is quality. The current ward environment was never designed for people with mental illness or sort of conditions such as Alzheimer's and dementia. We have, for example, people who have both Alzheimer's and schizophrenia being treated in the same ward, and they are very, very different conditions, and it does not lead for a very good experience or ease of treatment for people with such a wide range of conditions. And if we were looking at a physical health issue, we just wouldn't put 2 different specialties and 2 different conditions sort of in the same area. It just wouldn't happen. Historically, you know, we're in this position from a mental health point of view, but we feel that there's something that we can do that on balance is likely to improve that quality aspect of it. And in terms of experience, we're talking about wards that have got shared facilities, some mixed gender areas, which is pretty unheard of now, as is the dormitory style accommodation. And there is a national push to, understandably, to remove dormitory style accommodation for people. And some of the most vulnerable people in terms of their illness being put into mixed gender areas that have dormitory style accommodation with very shared facilities in some cases, so bathroom facilities, so on, and dealing with people with very different conditions and very different needs, we feel just isn't appropriate for the new modern health services. And indeed, we are advised, and we do accept, that the CQC is unlikely to continue to approve those facilities, as they don't meet a whole range of national standards. So there was a long list of options looked at. So if I run very briefly through these. So first of all, there's always the do nothing option. From a CCG perspective, you know, we want to commission the best services, and we know there are going to be compromises in terms of how we do that, and resources are always going to be finite. We can't throw money at every aspect of treatment, and we have to use, you know, taxpayers' money as wisely as possible. But we discounted continuing with the services as they are. They're becoming obviously increasingly outdated and relatively, you know, as we see other services elsewhere in the country improve, we don't want Bassetlaw to lag behind. A new build option with Bassetlaw would be a fantastic thing, but we don't have capital investment in order to do that, unfortunately. And even if we did, it would obviously still continue to provide services, not just to Bassetlaw residents, but to a much wider footprint. We could lease alternative accommodation, therefore avoid the capital expenditure, but the cost and identifying sort of that leased space that would really fulfil the needs that is so local, so within Bassetlaw, and I suspect, you know, ideally as near as possible as, you know, to Worksop, is both impractical and unavailable, and we think unaffordable. If we subcontracted the services in totality, we would be then talking about a new provider, and typically the only way to be certain about, well, who would come forward to provide potentially such a service is to put that out to competitive tender. We don't believe that it's the right time to start tendering NHS services to potentially private providers. They may come up with some very good and positive options, but it would also draw a bit of a gap between the community-based services that we are investing in, predominantly with Notts Healthcare, and then the inpatient services provided potentially by a different provider. So we want to provide more integrated services, not the opposites. So we didn't see that as a particularly attractive option. And then the final one, which is the preferred option in the engagement exercise, is to use the opportunity to transfer the inpatient services to new accommodation in Mansfield. And there are 2 sites, you know, sort of for that. So those 2 sites, one is a a facility that's currently held by a private sector organisation providing sort of healthcare services, but Notts Healthcare have had a business case approved to purchase the Sherwood Oaks site. In addition, we feel that they've got the opportunity to make the changes to really tailor it around modern health services for people with mental health issues. And that would include having separate male and female wards, all with ensuite rooms. So really quite a step change from the type of services we're currently able to provide at Bassetlaw Hospital. And secondly, for older people, refurbishing part of the Millbrook mental health unit. So it already has all of the services there and the specialist treatment. It would be a larger scale, so they'd be able to concentrate more of those. And therefore, we could develop really sort of very positive and appropriate services for older people as well in that separate site. And that would mean that people with similar conditions would be treated in the same area, not having different types of treatment with people with very different conditions in the same sort of area of the hospital. And everyone again would have their own room and ensuite facilities. So again, quite a step change from what we currently have. So I'll close it there and I'll close my slide viewing so we can open that out for sort of questions and discussion.
Thank you, Idris. I'll just open this out to members now. I'm just going to invite questions. If members can refrain from asking supplementary questions, this will allow everyone to contribute in the time that we've got available. Okay. Any questions for Idris and Victoria?
Yes, John, could I ask a question? It's Mark.
Yes, thank you, Mark. Councillor Watson.
If I could ask what form of community engagement was carried out while drafting these plans, because certainly there's not been much support for the plans amongst Bassetlaw district councillors, and certainly when I've described them to members of parish councils in my ward, there's been very little support from there. So I'd be interested to know what level of community engagement there has been.
Yes, thank you, Councillor. And obviously the engagement process continues, so we can discuss, and I think I'll bring Victoria in a moment because she's been leading on it. I am obviously fully aware of the concerns. I actually listened to the debate that you had within council on this matter in full. So I'm very mindful of the genuine concerns that people have, both with regard to the services based within Bassetlaw Hospital and the perception that that gives in terms of Bassetlaw Hospital, and also with regard to the travel. I think the wider public engagements, as I've said, on the investment and the type of areas that are being prioritised so far has been quite well received by the public, but pretty consistently they have concerns about the areas that you've identified and debated in council. So we're very keen to ensure that we are assured that we can address those as much as possible to mitigate against them. Obviously, my governing body will be making this decision, so not I, and it will make that decision sort of in a public meeting after the election. And I know that they will certainly want to take those into account. But in terms of the specifics of your question, in terms of what engagement we've carried out, perhaps I can bring Victoria in just to fill you in a bit more on that.
Thanks, Idris. We've undertaken at the moment an extensive public survey, so we've sent the link through to colleagues so that you can see and give yourselves opportunity to see that. We've had a good response so far, but we continue to ask for further responses. We've extensively circulated that link and wider comms around this work through a whole range of stakeholder and partner forums, using an extensive range of social media as well as formal communication and engagement networks, and that's extending well out of the Bassetlaw area as well. So that public survey is a key form of informing us about people's views and responses to the engagement and the questions that we've raised. We're also doing follow-up conversations by telephone for those people that are indicating that they're open to receiving those queries. We've formally commissioned a professional campaign company to work with us to undertake that, to make sure that the process is a robust one, and does also include obviously the wider population, and ensure that we include people from protected characteristics, for example, so that we've got a good mix of people responding to the survey, and that's a key requirement. So those in-depth survey telephone surveys will be really important to give a level of granularity to the responses that people have already given as part of that public survey. We're also doing a further tranche of telephone interviews, again across the wider community, making sure that we've got a good breadth of responses, as I've said before, across different age groups, ethnicity, locations, etc., to get a really broad range of views. We're also doing a range of focus groups with different community organisations, and also contacting patients who are using the service and have used the service, as well as families and carers, to again do some more in-depth survey responses and semi-structured interviews with them. We're also planning to go on to the ward area within the hospital to try and gain further access to patients, carers, service users who also want to come and speak with us about the proposals, and I'm hoping that those surveys will take place very soon. We've also established the Mental Health Collaborative, which is a forum that brings together a range of community organisations and representative groups, so that the voice of patients and service users and carers, and indeed our wider community, can be brought into the conversation. And we've engaged with that group on a number of occasions now and heard back from them their thoughts and the people that they represent, and those will be feeding into the overall analysis that the campaign company will be bringing to governing body. As well as those wider opportunities to engage with patients, service users and volunteering community sector organisations, and indeed partners and stakeholder organisations, we've also obviously engaged with Nottinghamshire County Council through the Scrutiny Committee. We've done that now on 2 separate occasions. We've offered to go for a third more recently, but we're going to go back to them in June now. We've also gone through a process of engagement with NHS England as part of the insurance process, and they've been very clear to work with us around the governance around the process that we've implemented to support engagement. And we've also gone through a clinical Senate review, which brings together a wide range of professionals, health and care professionals and specialists in mental health services, to ascertain their views on the proposals to date, and to make sure that those views will be brought into the final overall report that will be produced for consideration by the governing body. And obviously all this work continues, and we continue to actively pursue wider engagement as much as we possibly can. And we're also very keen to hear from colleagues such as yourself to see where we can continue to explore those opportunities for even further engagement. So hopefully that's answered the question fully, but we're happy to give more detail if needed.
Thank you, Victoria. Are there any other questions?
John,
Chair,
could I speak?
Sorry,
Yeah.
Chair, sorry, just to say that Councillor Sanders did indicate he would like to speak a few minutes ago.
All right, thank you.
But
I can't
whichever
see
order, I know.
if people put it in chat or just shout out. So, Councillor Sanders.
Chair, I'm quite happy for Debbie to go first, if that's
Okay.
anyone.
Debbie did shout out. Yeah. Okay, Debbie.
Sorry about that. I can't get
Councillor
the chat.
Merriweather.
Yeah. Right. The only thing that's worrying me about this is I've worked in the NHS for over 18 years now. And every time something goes out to the community, it's all brilliant and it's working, and it gets sold to the community that it's all singing and all dancing. The only thing is, as soon as the money gets withdrawn and they need to put it into other fields, they tend to get rid of all the district things that they've set up. Like, i.e. my son's autistic, and they had a lot of community things going for autistic children here. Then all of a sudden the funds got cut, and what did they do? There's nothing now for autistic children around here now. And my worry is, if they do away with the mental health wards and they promise them all singing, all dancing, And then when the money is not there, what they're going to do is when they have to cut back on services, is mental health going to be one of the services that gets hit? And then we have agreed to something that's actually, it's not going to provide the service for our Bassett Law community.
Shall I respond to that, Chair?
Yes, please.
Okay, thank you. So I suppose two aspects of that. The health services establish a mental health investment standard that every commissioner is trying to achieve. We have put in our plans for that to be achieved. So that's already built into our long-term financial plans. So if we obtain the amount of money from government that we are expected and is anticipated, there will be no risk to the mental health investment, because that's something that we've committed ourselves to do. Of course, services are provided by a whole range of organisations with whole different funding streams, whether that be through local government or charitable funds and so on. I'm very conscious that resources ebb and flow in that respect, and there can be cuts made. But from an NHS point of view, the 4 million that we are saying that we are investing, we are as confident as we can be that not only will that investment go in, but it will never come out. That is something that we are committed to doing. What happens in the future, so beyond our sort of timescales, is something I can't sort of predict, but I can only say what the intention is, and that it's in our plans, and we do not envisage a penny of that money being withdrawn once it's been invested.
Thank you. Councillor Neil Sanders.
Yeah, thank you, Chair, and thank you very much for the presentation. I like a bit of a buy one, get one free, if you just indulge me a little bit, Chair, because I do have two questions in one. Firstly, if I may ask, we talk about Bassett Law Hospital, and obviously that's based in Worksop, but Bassett Law is a very rural area. And some of these rural villages are actually closer to Doncaster than they are to Mansfield. So with that in mind, would people in mental crisis be forced, if that's the right word, and I apologise if it's not, to go to Mansfield, or would they be able to access mental services in the Doncaster area? And also, with certain physical emergencies, there's what I'm told is like a golden time period for people to access treatments. Is there a similar timescale with regards to people in mental crisis? And, if so, could you just expand on that and how it would be affected by the physical travelling time that it would take to access inpatient care?
Yes, certainly. Thank you, Councillor. In terms of where people would want to choose to receive their care from, other than being potentially sectioned, then people will have a reasonable degree of choice in terms of where their care is received. So yeah, and it's their family as well in some cases, depending on sort of whether the patient is sort of competent to do. So I imagine that some people do already access Doncaster and would continue to do so. Maybe one or two more, sort of would do, some more than that. What we are trying to do though is to try and make the care seamless between hospital and community, and it is easier if they remain under the Notts healthcare, but it's certainly not something which would be a barrier to them receiving inpatient care elsewhere. In terms of your second question, I think somebody in mental health crisis, time is of the essence. Now, there are different levels of mental health. Some obviously with, say with Alzheimer's, may have an episode or sort of a period of time where they're really struggling or they need to be stabilised and so on, but can come on quite gradually. Others are in mental health crisis and in risk of their own life or that of others. We are investing in, and we will establish a 24/7 crisis intervention team based in Bassetlaw, and that will also link and support the A&E department. So if they had to then admit somebody, then they would have to go to the inpatient facility, not remain in Bassetlaw. But the intervention, the assessment will be available 24/7 and based with a local team in Bassetlaw.
Thank you. Councillor David Presley's got a question.
Thanks, Chair. Thank you. And thanks for the presentation in this. My question's in two parts, really. I agree with the improvements that you're going to provide. I think that's what we need in Bassetlaw, but we want them at our hospital. And that's what I'm hearing from the people I know. The thing is, when we do this and all the consultation comes in and it says, let's stay in Bassetlaw, what is plan B? What is the provision that you're going to do if everybody says we wanted to stay in Bassetlaw? That's the question. And the consultation responses to me, you look as though we've already decided that we're going to Mansfield. And it really doesn't matter about the consultation because the hospital in Mansfield is geared up now to do it, and we're gonna go to it. So I think what the people are saying to me is what is going to happen to us when it's an emergency and we want to go straight in, and then it's full at Mansfield. It's full now because it's full. Everybody's filled it up. Where do we go then? Where does our people from Worksop, Retford, and all the villages go if the facilities in Mansfield are full? So it's two questions, and probably a third one. What are we going to do with the wards that we've got? What are we going to do with them when they're freed up? And where? Because we were promised that our children's ward would be put back together, and we wouldn't have to send our kids to Bassetlaw, to Doncaster and Sheffield again. And I know they go to Sheffield because my nephew had to go to Sheffield. He had purpurea after German measles, and he had to go to Sheffield. And I thank Sheffield for that. It was brilliant. But there's about 3 questions in there. It's just nice. And just one little anecdote. My mum was in B2, I think it was, and it were brilliant at the time. So why didn't we get together and do it now before? And the consultation ought to have been last year when you were providing to do it, and not now when we're nearly going to do it.
Okay, I'll try and answer each of those, Councillor. So first of all, first of all, you said you approved of the investment, but you want actually the services in Bassetlaw, and I hear that. You know, and I think if I was sort of in your position, you know, arguably that's what we would all want to see. But we have to establish the best services possible within the resource and the constraints that we have. And I think it's a bit like local government, isn't it? You know, that's the chance of difficult decisions that sometimes we have to make. If the engagement comes back, and I'm sure that it will continue to express concerns in terms of the distance in particular, then we will take, you know, sort of those issues on board. But the engagement exercise is to identify both the strength of feeling, but also the things that we might not be aware of, and also how things could be mitigated and what ideas people have. So, you know, there's a broad range of things that we hope to get out of this engagement, and it is quite a comprehensive engagement. Formally, you know, there can be debates about formal consultations on, because the numbers involved, frankly, are small compared to the vast majority that we do. But we really wanted to do a thorough engagement exercise to address each of those elements. Do we have a plan B? We'll have to see. I'm not going to preempt a decision that my governing body will make once they've got all of the findings. But I'm sure that what we'll be interested in looking at as well is how those concerns might be addressed, and is that sufficient? And therefore, where on balance does the best decision lie? And we'll have to see that, how that plays out. In terms of Mansfield, the business case for the Sherwood Oaks facility and for the investment in terms of improving the Old People's Hospital, those cases weren't predicated on Bassett Law moving. So they were approved quite some time ago before we even did this engagement exercise. So depending on your point of view, you could see this as an opportunity at very low cost for us to improve the facilities. That allows us therefore to invest £4 million into the more community-based services and all the things that we've been talking about. But they would have gone ahead and still used, redeveloped those 2 sites in Mansfield even without the Bassett Law patients. And indeed, they're doing that. They don't know the results and they've purchased it. It's that is going ahead. In terms of the wards, and you went into the children's element of it as well. As you know, we are expecting government to release approximately £17 million to improve the acute services at Bassett Law Hospital, and that's capital money, not recurring revenue money. But obviously it's a significant investment, and it allows us to look at the space, not just at the A&E department, but children's assessment. And the key there is that currently we have A&E shifts with specialist children's nurses on them. And then we have a paediatric assessment unit that's open about 7 days a week, 11 hours a day, thereabouts. But it's 2 separate rotas, and you'll probably recall that the reason that we had to take really short-term emergency measures was because of the lack of specialist children nurses with regard to the children's wards. And we're still trying to staff 2 rotas with them. So physically, if we can combine the assessment areas and have a purpose-built children's assessment area, then we can combine those rotas, and therefore we can extend the length of time, sort of that we keep supporting children. That isn't necessarily a ward as such, but it could be a 23-hour, 7 days a week facility. So you'd really then only get the people, as you've just described, that really need to be acutely admitted where they can get the best care possible for their very serious condition. The vast majority don't require that. The majority, they are relatively low numbers now, thankfully, that are transferred to Doncaster predominantly. Most of those get discharged the following day. So if we could just combine that assessment and extend that period, then we would envisage very, very low numbers, and only those that really have to, emergency surgery, for example, being transferred to a more specialist unit. The wards allow more flexibility in terms of all of those changes, and including medical and surgical assessment, A&E and paediatric assessment. So there's a domino effect in terms of the opportunity of using the available space at Bassett Law Hospital. That means that we would be able to then maximise the benefits of that £17 million worth of investment, rather than being constrained into a much smaller area. Just gives us more flexibility to design that, so in the best way possible.
Thank you, Idris. Councillor Lynn Schuler has a question.
Thank you. I'm just looking at the children's mental health services that you talked about. Can you kind of outline what the plans are for children's mental health services? Are they in line with transforming children's mental health, with like designated leads in each school, etc.? And then for the very acutely ill children and young people, where would inpatient services be? And then looking at the perinatal mental health services, where would they sit, and how would they link in with the community services that we have at the moment for new mums, pregnant, expectant parents, etc. Would they sit alongside our existing community services that we have, because they are clearly provided by the same trust? So literally, are we looking at specialist mental health, health visitors, midwives, etc.?
Okay, I'm going to bring Victoria in to hopefully cover some of the detail perhaps of that, but I'll give it a first stab. So yes, there will be investment in children's and adolescent services, including schools and community-based teams. And I think Victoria may have some more details on that, but that's certainly one of the priority areas that we've identified. In addition to that, having sort of those specialist services that you've described. The children's inpatient beds is what we call Tier 4, and that's a specialist commissioned service, which does provide a sort of much wider population support. They are really quite specialist there, so they're not directly impacted on here, and we don't commission them. So Tier 4 services for children's inpatient beds is commissioned by NHS England on a more regional level. So that doesn't directly come into this or our remit. Perinatal services, yes. Local services, expanding the current teams accordingly. And overall, I mentioned sort of several times now, £4 million worth of investment, but actually it's over 50 full-time people across the range of those services. And so it includes the ones that you've just raised, but the wider ones as well. So this isn't just money going into sort of existing budgets and things. It's a real significant increase in the number of staff that will provide the services. That's where this investment is predominantly going. Victoria, is there anything else you wanted to add that I've missed on?
Well, I just wondered if it might be helpful for me to just give you a very, very quick rundown of some of the key areas we are supporting around children and young people's mental health, if that would be helpful. I'll keep it short, but just really important, I think, would give you a breadth of the, a flavour of the wide breadth of services. So for example, yes, perinatal mental health services, we all know that a good start in life is absolutely paramount to supporting overall health and well-being and supporting people to remain resilient in later life around mental health. So we have now a mental health midwife in DBHT, so supporting that interlink between the community service provision and the secondary care team. And the funding for that service has increased, as Idris has mentioned, in 21-22. But other key things that we're doing is working really closely with schools. So we've got Each Amazing Breath undertaking the Take 5 initiative. So we've invested in that service in all primary schools. And we're trying to get as many primary schools on board with that programme as possible, and by expanding the number of schools involved over the last 6 months or so. And that is evaluating brilliantly well, supporting young people to maintain their resilience. And we've shared some video footage of the impact of that on local schools. In secondary schools, we've invested significantly in the development of the mental health support teams in Bassetlaw, and we have full secondary school coverage for those teams that commenced earlier this year. Whilst those teams are undertaking further training, we've also supplemented that support, investing in Talk Zone, and they will be providing some services into secondary schools locally, Portland and Valley, with funding from the CCG. We've also funded Talk Zone more generally as well, some significant additional investment to provide additional counselling support to younger people and children, particularly during COVID, when we've recognised a significant impact, as we said earlier. And we know that there's a growing waiting list for that support, particularly around things like self-harm, for example, which we know has been an increase locally. So we've increased funding for Talk Zone in terms of their core offer, as well as those additional talking therapy type support, and that's over 160k additional money that's gone into them. Recognising that increase in self-harm, we're also additionally funding Harmless to do some support with us focusing actually on over 18s, whilst Talk Zone supports those children younger than 18. But we've asked for Talk Zone and Harness to work much more integrated, and again working with our existing services, for example, Iap. And we've also invested in Iap in more work. They're doing more work with us, particularly making sure that we don't have, as much as possible, any increases in waiting times, because we know that that's been an issue. And that also includes more support around webinars, for example, to support remote access. We've also invested in COOTH, which is an online children and young people's emotional support and counselling services. And that will be providing support alongside another service we've also commissioned to provide online support called Quell, and that's for the over 18s. So there's no gap in any service offer we've got over those age groups, and obviously transitions. And we've also very much invested in Mind to work with secondary care to provide a wider all age offer for mental health and wellbeing, particularly in the area of peer support and access to wellbeing coaches, because we know that is a really good service offering that people have very much valued. And we've also increased funding and investment around our eating disorders.
I'm finding this, I'm not being rude, I find it really interesting. I'm conscious we've got that many questions.
Okay.
We all want to get in, Chair, that's all. I'm conscious we're going to have to go. I thought that was a brilliant answer. I'm getting the picture. We've got a lot of extra support coming in for young mental health services.
Absolutely.
Can we go? Is it all right if we move on to questions, Chair? I'm sorry.
Councillor Coulter, we have got two other people waiting to ask questions.
Yeah, I know, Chair. It was in response to the answer. It was a quick answer. We're up to four minutes. And what I'm saying is,
yeah,
we need to be quick. This is a really important subject, and I want to hear my colleagues' questions. That's all.
Okay. Point.
Can I just ask?
Stop interrupting then.
And this is a yes or no answer. Do we have a designated lead for mental health in all schools, and do we plan to have one?
I don't know if we have a designated lead in all the schools. We have a mental health support team that work with leaders in those schools and counselling services that work with leads in those schools. But I couldn't give you a definitive who's the mental health lead in schools. That would be something that we would need to pursue with the schools themselves.
Thank you.
Thank you.
I'm just going to go to Councillor Maddie Richardson now, who's waiting to ask a question.
Sorry, Chair. This is just a question on the amount of money actually addressed to you, please. In the government white paper, it suggested that the CCG might go 2022. I hope you don't, because we need you. But I'm just wanting to know, will you be able to still have confirmed the 4 million if that happens, please?
Yes, thank you, Councillor. You're right, of course, in terms of the white paper. The 4 million is in our commissioning plan. So all of the commissioning functions under the white paper would then transfer into the integrated care system. One of the things that we're working hard to establish is that current plans will remain sort of in existence, so they won't be affected. So that's the expectation, that's the agreement in principle that I've received. So although the functions will transfer into an integrated care system, the plans will remain the same.
Thank you.
Thank you. I've got Councillor Helen Tamblin-Saville.
Thanks, Chair. Before I go, I think Councillor Plevin had her hand up a couple of times, so I'm happy to let her go first and I'll come in after.
Okay. I didn't see that. Councillor Plevin.
Thank you very much, Helen. That's very kind of you. It's just a question. It's sort of similar to about the autistic children, but it's not just about autistic children. It's about a lot of families that have got special needs children, young children, older children, and then into adulthood. From the feedback I'm getting and my own experience over several years, it's a shambles in that area now. What are the guarantees, absolute cast iron guarantees, that there is going to be a huge 100% improvement because it really is. The support for special needs with mental health issues is appalling in this area. Thank you.
Thanks, Councillor. I'm not sure I'm in a position to give you that 100% guarantee, largely because a lot of the support and services that are provided are not from the health service. So again, it's not entirely in our remit. Obviously, some aspects of care are, but certainly not all. So I can only describe the investments that we're making, not the decisions of other organisations.
Thank you. Okay, Helen, Councillor Tamblyn-Saville.
Thank you, Chair. Thank you for the presentation. I have to apologise. I did miss some of it as having some internet problems and had to very quickly relocate. I was looking at your presentation on the screen and what you were saying about the mental health wards. And like some of my colleagues have mentioned, concerns I have are about travel again. Obviously, like everyone, I welcome the improvement. Mental health is something that is very important to me. I spoke about my own experiences at that council meeting, and I know the value of having a really good support network around you of your friends and families as well, and how valuable that is. My concern is that, you know, really moving to Mansfield is potentially going to stop people from having those support networks around them, particularly those who have from low income. Public transport isn't readily accessible for them, etc. So is there going to be some kind of proposed visitor transport service to take that into account? Thank you.
Thank you. So the current thinking, and this is understandably, I think, one of the biggest single issues that has been identified in terms of not just the convenience for the individual patient, because to be honest, they will be admitted and they'll be discharged, so the number of journeys is limited. It is that support network in addition to that, and all outpatient services and other services will continue to be local. So, you know, there's a distinction there to be made. But you're absolutely right in terms of that support network, particularly for low-income families. At the moment, the thinking is that when you look at the numbers of people involved, having a dedicated or routine transport service just isn't viable. Yeah, there's no point in running a bus backwards and forwards when you're talking about a very, very small number of people that might utilise it. So we're talking to Notts Healthcare Trust about other options. So wrapping around individual transport plans around the patient, the family and their support network to ensure that they obtain. And if there is an issue with regard to affordability, then that is built in. So we pay for the transport that we design and wrap around the patient and their family and their support group. So very bespoke and targeted, but with funding for them where that's appropriate. It is the current thinking. We'll see how that develops as the engagement process continues, and Notts Healthcare continue to work that up in more detail. And that's certainly something which I think the CCG governing body is going to look at very closely.
Thank you.
Chair, sorry, Chair,
Yeah.
just to let you know that Councillor Bowker has requested to speak, please.
Councillor Bowker, you've not spoken yet. Go on.
Thank you, Chair. Sorry, I've got quite a brief question, and depending on the answer, it might be a supplementary question, but I'll try and keep it as brief as I can. Would there ever be an expectation for service users to make their own way to the new provision in Mansfield? Obviously, that might put on the spot a little bit. It's great that there's a crisis team available at Bassetlaw. That's great, and I'm sure that everybody welcomes that. But it's, again, touching up on the transport issue, if service users were expected to make their own way to Mansfield, we've got to remember that a lot of these people are the most vulnerable in our society. Probably they might not be able to drive, so then you're looking at bus fare and things like that, and issues of getting there. So I've actually done a bit of research and some statistics regarding getting the bus to the locations, both at Millbrook and at the Sherwood Oaks site. And this is going from Bassetlaw Hospital to to these sites. And I mean, via car, it's not too much of a problem. It's about half an hour away. But even half an hour is really, that's too far if somebody's on the verge of harming themselves. But when you look at the bus timetables, it's quite frightening, the stark reality of it. I mean, so Sherwood Oaks, and these are stats that I've got from the Stagecoach East Midlands website. So the minimum time it would take to get from Bassetlaw Hospital to Sherwood Oaks is by catching 3 buses, 2 changes, and the travel time on that is 1 hour 48 minutes at a minimum. And for the Millbrook site, again, it's 2 changes, so again 3 buses, and a minimum time of 2 hours and 36 minutes. It's not quite good enough, really, for somebody that could be on the verge of on the break. So that was my question in a nutshell, really. Of would there ever be an expectation for service users to make their own way to hospital? Thank you.
Good question. Thank you.
Okay, thank you. So that in part links, I think, to the last question, but just to expand slightly on the points that you've just raised, I would not envisage any patients ever having to catch 2 buses and to spend over an hour trying to get to an inpatient facility in order to be admitted. I just don't, that won't happen. Obviously, there are various options that, could be family member could take them. That's more often than not, sort of what people would prefer. Ambulance service for the particularly ill, taxi service or other service that's laid on in terms of patient transport. Some of these admissions are relatively planned. Some of them really are acute and emergency, so they'll be dealt with in a similar way. We wouldn't expect somebody who'd been admitted with a physical injury to Bassetlaw Hospital that needed the type of surgery to take place at a different hospital to then get on a bus. And I think this parity of esteem is really important. So mental health patients should not be treated any differently from that. So we will be looking at the transport plan closely that Notts Healthcare are developing, but I would envisage that support being available and being described in a robust way. I think the other thing to note is, and I do get this issue about transport, particularly around public transport, and particularly about those that can least afford it. There are a number of patients who already allot and choose to be treated not in Bassetlaw Hospital, but choose to be treated elsewhere as inpatients in Nottinghamshire. So at any one time, we've always got a proportion of Bassetlaw residents outside of being treated as an inpatient outside of Bassetlaw by their own choice. Now, they're not large numbers, but they're not large numbers in Bassetlaw either, 100 per year. So they do make up a proportion of that, yes. So the arrangements are already in place to support them in terms of transport, and we'd like to see how they would be enhanced in order to support people if we move to the new facilities, sort of in Mansfield and the Sherwood Oaks.
That's wonderful. Thank you, Mr. Griffiths, for clearing that up. Appreciate that.
Thank you for that. Yes, if I was going to ask a question, it would have been similar to those last 2 about the transport issue, and I can see that you're going some way towards answering that. Is there anybody else who hasn't asked a question yet?
Chair, Councillor Cultate hasn't asked a question yet, but then you do have Councillor Pressley in the wings.
Yes. Councillor Pressley.
Councillor Cultate, do you want to? First, he's not asked yet.
I'm happy to see if Councillor Presley's got something urgent. Go on. I'll continue. I'm not sure.
Mine are always urgent.
They are, Councillor Presley. They are. I'm just wondering. I've had a look through all the documentation, and I would have expected to see some kind of research somewhere about not having mental health services near to where you're geographically located, if that impacts on outcome. So, for example, it's known I'm not associating mental health criminality, but one example is prisons, one example is education. it tends to be, if you're not educated or you come into them environments and it isn't within your community, the outcome is actually worse. I'm wondering if there's been any kind of research into mental health services about similar work. So if you access it out your community, does the outcome suffer?
So Victoria may know, but I'm not aware of any specific research in that respect, Councillor. But I'd make two observations, though. First of all, for outpatients, for sort of therapy, face-to-face, support in the community, support for people with mental health issues in their own home, so they can stay in their own environment. I'm sure there's lots of research to support that. Hence, sort of why we're investing so much in Basset Law-based local services. The other observation I make is I've mentioned a few times that inpatient mental health facilities don't typically locate in district general hospitals. They are now more specialist facilities. The numbers of inpatients in mental health has reduced very significantly. They've become far more specialist and I think improved in terms of the therapy and the specialists that can provide. But they support a much bigger population than that which is served by a district general hospital. And I suspect that there's quite a bit of evidence supporting, sort of that. And Victoria mentioned the clinical senate that we have written to with regard to the potential move. And they are providing us with expert clinical opinion that's totally objective in terms of, they're not part of the CCG or part of Notts Healthcare. They are separate objective experts in their own fields, are commenting on the model of care, including the location of it. But specifically in terms of research, I'm not aware of any. I don't know, Victoria, if you wanted to add anything to that.
I'm not aware of any research that does a correlation between proximity and outcomes for inpatient care. No. I would suspect there is a much stronger correlation with the range of specialist skills and the specialist environment in which inpatient care is supported. But I think you make the absolute good point there, Idris, about it is really important that patients do as far as possible maintain their support in a local community in which they feel safe and secure, and actually keeping services generally closer to home provides that and enables that much more. So hence the reason why we do want to invest much more to keep patients locally and have far better integration of teams to create an integrated package of care for patients.
Thank you for the detailed answer.
Thank you. Councillor David Presley.
Thank you, Chair. Thanks for bringing me back. It's about the 4 million investment. Is that for capital or is it revenue? How long does it last? And have we got enough money to keep going? That's what that's come out tonight, I think. And also, on the transport, we used to run it to Doncaster because I used to go when I had the prostate cancer, and that were great. Mansfield, there's no bus service, as Councillor Barker said. It is a changes. So myself, who can't drive now, if I want to go to Mansfield, I have to go on them 3 buses to see somebody. What are we going to do something about that, Idris? I think that's the big thing for Basset Law tonight is transport. Are we going to have the money to keep it going? And is it when we get to it, is it worth it? That's the thing that people are asking us.
Yes, thanks, Councillor Presley. So the 4 million is revenue. It equates, like I say, to around about 50 full-time staff. So maybe more than 50 staff if they're part-time, but it'll equate to 50 full-time staff. It could be 100 staff. And they're permanent. So this is recurring investment. It's not one-off. So once we're up to investing that 4 million over the next sort of 2 to 3 years, it then continues every year. So it will be a £4 million increase as of sort of last year's money in perpetuity, and hopefully more besides, to be honest, because I think this is a good step in the right direction. Personally, as a commissioner, I'd like to see more money invested in mental health in the coming years, but I'm very much welcome being able to put this money in. In terms of the transport, I think we have touched on the shuttle service between the hospital sites is viable and sensible from a financial point of view, because a lot of people use it, relatively speaking. The numbers from a mental health perspective, inpatient perspective, are so low that it doesn't really make that a viable option, which is why we need to look at very bespoke wraparound transport support and services for each individual and the people who care and support them in their network. But as I've said before, that we will be looking at the response on that.
Thank you. I think we've had a really good.
Chair, just to add that Councillor Sanders has asked if he can speak, please.
Okay, Councillor Challoner hasn't spoken yet. I wondered whether you had a question.
No, thanks, Chair. I've been listening in it very intently, and I think there's been some very important issues raised. And I think, obviously, the preparation with the mental health service, because I think when they say that we're going to get back to some kind of normality, I think the impact of loneliness and things like that is going to have a massive impact on this service. So it's the opportunity for us as councillors to ask the specific questions, but also let's hope that everything that has been spoken about is put in place and there is a proper transport link so it can deliver a service that is going to be required in the future. Thank you, Chair.
Thank you for that. So last question, Councillor Neil Sanders.
Thank you, Chair, and thank you for letting me come back. I'll be brief. I just wondered whether the increase in housing and the massive expansion that's going off with regards to building in Bassetlaw was taken into consideration when these plans were put together. And I just wonder, just picking up on what Councillor Challoner has just said, whether the impact of the pandemic has also been factored in, because we don't know where we're going to be with regards to people's mental health once all this is over and done with. So I just, they're my questions, Chair. Thanks very much.
Thank you.
So, first of all, in terms of capacity and what has been factored in, the inpatient bed capacity overall will increase by 8 beds. Sort of net, which, when you look at the size of the wards in Bassetlaw, is quite a good increase proportionately for the numbers. And the units in Bassetlaw are not full, really, at any particular time in the first place. So it does build in an increase that is not insignificant in terms of inpatient bed capacity. Will that be sufficient for all the needs? Well, I think it's going to be the community-based services. If we rely on sort of, there's such a level of acuity in order for somebody to be admitted as an inpatient, we really do need to intervene and support people before it gets to that point. Will £4 million be enough in terms of all the pressures that you've just described? I think that's a good question, but it's not one I can specifically answer, because I have the same concerns as you in terms of the wider impacts of COVID. And we're talking here, we touched a lot on, quite rightly, children and adolescents, and some of those could be very long-term problems that may take years in order to come to light. And I think as a whole community, and I say this not just for Bassetlaw, but as a country, we need to be able to be in a position to support people that have been and will future be impacted by COVID. And that's before I get on to the difficulty that people will have, sort of financially, and the pressures on homes and issues around domestic violence and the economy yeah, the impact of COVID is going to be living with us way beyond, you know, sort of a successful vaccine programme. And I hope we don't have any new variants, but we've got some very significant challenges as a community ahead of us.
Thank you for that, Idris. Could you just remind members how they take part in the consultation and what the deadline is?
Victoria, remind me of the deadline. There's a website, there's a survey. It's all, we've got a dedicated web page. I think we've sent the details, we made them available. I'm not sure if they were sent down, but it's all in there. But Victoria, you fill the gaps.
It's the 18th. Although I think, you know, if we got a few days after that, you know, we still want to be inclusive, but technically it's the 18th. But there'll be an ongoing process of engaging. As we've said, it's not just going to be we won't speak to people anymore. That's not the way we want to do this. We want to keep talking to people and making sure that what we do is the best that we can possibly offer for Bassetlaw people.
Thank you. That's 18th of April, isn't it? Yes. Thank you very much. So I'd just like to say thank you to Idris and Victoria for a very interesting presentation. Thanks for your detailed responses to members tonight. We do on this committee appreciate, you know, this partnership and then engagement, and you know, I hope it will continue. And so, as I usually say at this point, you're welcome to stay, but equally, I know you may have other things to do tonight.
Thank you very much for your time. It's much appreciated, and we do really appreciate the challenging but the constructive approach taken by the committee. So thank you very much.
Thank you.
Hope to see you soon. Thank you.
Cheers. Bye. Right, we're moving on. Agenda item 7 is the forward plan. Just to remind members that as soon as you receive your agenda, you can ask the clerk to contact the relevant officer to provide a briefing note on a particular report on the forward plan, or invite them or the cabinet member to come to the meeting. Also, private and confidential issues will be dealt with in that section later in the meeting. So page 17. (18) and 19 forward plan. Does any member have any questions on the forward plan?
Is it page 17, Chair? The Cabinet on the 1st of June, the environmental enforcement.
Yeah.
Would it be helpful to have somebody from that side to come and talk about that? It's important, that one. It's a pilot, isn't it? So we're looking at whether we're going to keep the pilot going, aren't we?
Review of the pilot.
Yeah.
Yeah. Richard, just remind us of the dates. I don't think we're going to be able to
get it in.
No. Before we meet again, as it were.
Chair, if
yes,
I can,
Chair.
Sorry. I was just going to add that I think that item on the forward plan is likely to move to a future meeting.
Right. Okay, so we will get a chance to probably do some pre-scrutiny
in the new municipal year. Yeah.
In the municipal year.
Thanks, Chair.
Thank you. Good point. Are there any more questions on the forward plan?
Yes, Chair. May I just ask about the housing services structure? It's on the same cabinet meeting, a review and position. I'm not quite sure what that is. I'm wondering whether we could just get hold of someone to send some report for us to see, or is that not going forward anywhere, Linda?
As far as I'm aware, that one is staying at the 1st of June meeting.
So I ask questions before then?
I would suggest possibly that we could make a note of that request and ask the head of housing to circulate somebody to present committee members.
Would that be all right, Chair?
Yes, it would. Yes, a briefing note. Yes, I mean, obviously when the papers come out prior to the cabinet, we'll have full details then.
It's just I have a few questions on housing, and I just want to know whether it came into that category.
Yeah.
Chair, if I could just remind members, obviously there's nothing that precludes members from approaching relevant officers at any point to ask basic inquiries, so you can do that. But I take on board the comments. I'm sure we can get an overview of what that report is likely to contain and circulate that to the committee in advance so that you're prepared, because obviously as a key decision it will come automatically to you for further consideration.
Yeah. Thank you. Any other comments or questions on the forward plan?
Chair, Councillor Challoner.
Councillor Challoner, yeah.
Obviously, Councillor Presley spoke about the environmental enforcement review. Maybe an update could come in with that, because it could come under the similar section, like with dog fouling and things like that, when renewal of the public space protection order for dog control. Because reading what the thing that Julian Proudman sent out for consultation and asking for comments and everything, the dedicated areas that do come under Bassett Law District Council's control, I do know that a resident or a parishioner, because it was the vicar, commented on one of the areas which is blighted by dog feces. So it might be an idea if a report could come in, because they might work cap in hand with each other.
Yeah, I don't know if anybody wants to, any officers want to comment on that.
Thank you, Chair. I don't think any of the officers present here tonight can give you the detail on that, but again, we can take those questions back to our relevant colleagues.
Yeah, I mean, I think what we're talking about there is possibly an all-member briefing on the outcome of that review and, going forward. But we can feed that question back to the relevant head of service, can't we, Steve? Thank you. Yeah, just a reminder for the members to pick these questions up before, if you can, and then we can make sure we've got the appropriate officers there. Any more questions on the forward plan? No, thank you. Moving on to item 8, key decisions of Cabinet, 16th of March 2021, page 21 to page 27. Starting on page 21, we've got the review of the Disabled Facilities Grant and Adaptations Policy, key decision 617. So the Cabinet resolved that 1, the recommendation to remove the means test in respect of eligible council tenants requiring an adaptation to their home where it is considered reasonable and practical to do so be approved. And number 2, the revised Disabled Facilities Grant and Adaptation Policy be approved. Does anyone have any questions? Is anyone against endorsing this decision or wishing to abstain? No, that key decision is endorsed then. Thank you. On page 22, Housing Revenue Account, HRA Business Plan, 2021/22 to 2025/26, key decision 843. The Cabinet resolves that number 1, the Housing Revenue Account Business Plan for 2021/22 to 2025/26 be approved. And 2, that potential changes to the housing policy arising from the Housing White Paper be noted. And 3, the Head of Housing monitors any potential changes to housing policy arising from the Housing White Paper and brings further reports to members as and when required. Does anyone have any questions?
Hello, John. It's Mark here.
Yeah,
I had submitted a question earlier in the day about electric vehicle charging points, which are mentioned in the minute there, and so that for new build properties, then there will be a provision made for charging points. But I asked a question regarding the provision of charging points for existing council properties. As obviously if they have no access to off-road parking, then that's a problem. And Linda had forwarded this, so there was a reply that we had from the head of housing saying that in addition to new build housing, we will look to install on-street charging points as part of a refurbishment and regeneration scheme, and gave a couple of examples, and said that on traditional estates they'll be looking to put driveways into properties rather than communal parking areas in future. Just when we get to the carbon strategy a bit further down, it does stress the importance of providing electric vehicle charging points with the changes in transport that are envisaged over the next few years. My worry is that if this is a 5-year budget plan for housing and we haven't specifically mentioned that as a cost factor, it may get overlooked. And so to just try together to tie in the carbon strategy into the other plans that the council is putting forward, is that something they should look at?
We can certainly pass that question on to Alison Craig. I think members will have had a chance to see your question and Alison's reply that you just mentioned. Yeah, but I think what you're just saying is about specific allocations within that 5-year plan to ensure that happens. So we'll pass that question on. Is that appropriate, Steve?
Absolutely, Chair, and you may want to minute that as well, just to reinforce the point if the committee is in agreement.
Yep, I think we do. Yes, I think we want to minute that. I mean, we can all certainly see that continuing to be more and more important. Electric charging points.
Thanks, John.
But it's good to see those plans for modernisation, isn't it? Are there any more questions on that item? Is anyone against endorsing the decision or wishing to abstain? No, thank you. That's endorsed. Just moving on then. Page 24, Housing Strategy Refresh, 2021 to 2026, Key Decision 844. Cabinet resolved that 1, the progress that has been made against the objectives contained in the Housing Delivery Plan 2017 to 2020 be noted, and the Housing Strategy Refresh 2021 to 2026 be recommended to full council for approval. Does anyone have any questions? Is anyone against endorsing this decision or wishing to abstain? Thank you. That key decision is endorsed. On page 25, we've got Q3 2020/21 performance outturn and council plan progress update, key decision number 869, which of course is on our agenda. Cabinet resolved that 1, the contents of the report and appendices analysing our performance and council plan progress for Q3 2020/21 be noted, and 2, no further action is required to address areas of performance that are currently off target. Does anyone have any questions? Of course, you get a chance to ask about this in a few minutes. Is anyone against endorsing this decision or wishing to abstain? No, thank you. Key decision is endorsed. And also on page 25, target setting 2021/22, key decision 870. Cabinet resolved that the contents of the appendices be noted and the revised suite of corporate performance indicators and proposed targets be approved. Does anyone have any questions? Is anyone against endorsing this decision or wishing to abstain? Thank you. That key decision is endorsed. On page 26 of the draft Bassetlaw Local Plan update, key decision 543, Cabinet resolved that 1. The current progress on the development of the local plan and the approach taken to consultation between November 2020 and January 2021 be noted. And 2. Thanks be recorded to the Planning Policy Manager, the lead neighbourhood planner and the planning policy team for the work undertaken which enabled the latest successful consultation exercise to take place. Does anyone have any questions? And is anyone against endorsing this decision or wishing to abstain? No, thank you. That key decision is endorsed then. Page 27, the carbon strategy, key decision 872. Cabinet resolved that 1. Proposals within the draft carbon strategy be approved for consultation. 2. The proposal for continuous and ongoing monitoring of the Council's emissions be supported. And 3. The preparation of heat and energy decarbonisation for all Council-owned buildings be supported. 4. The leader nominates a Green champion from within the Cabinet to represent the political carbon agenda. 5. An environmental awareness and management plan for staff commuting and behaviours be supported. And 6. A platform to connect with and incentivise low carbon behaviours for Bassetlaw residents be considered. Does anyone have any questions? I've just got a comment that point 5 about the management plan for staff commuting is something similar to what we recommended on the Scrutiny cycling review about travel plans, active travel for staff. Is anyone against endorsing this decision or wishing to abstain? No, thank you. The key decision is endorsed. Okay, we now move on to item 9, waiver call-in, decisions taken without sufficient notice. There are none. Item 10, possible call-in of decisions made by Cabinet or Cabinet members. There are none. So item 11A is Q3 2020/21 performance outturn and Council Plan progress update. Pages 29 to 102 of your agenda. I'll pass over to Stephen Brown now to outline the report and answer any questions.
Thank you, Chair. I think members of the committee will be fairly familiar with the format of this report now. There are 4 elements to it. The first is that we have identified a suite of indicators that form the corporate health check. So these come from a range of different backgrounds and areas, but really it's intended to give a sort of temperature check really on how the authorities are performing. That's at Appendix A of the report. You then have the full set of corporate performance indicators against the portfolios, and they're identified at Appendix B. The exceptions, those that are performing off target, fail to meet target, etc., provided at C. And then the final part of the report is an update on progress against the council plan actions and a whole host of actions that sit behind to support the objectives that form our council plan. Within that, I'm sure members will have noted there are a number of areas that are indicating red within that plan, but I'm sure if any of you looked at what sits behind that, there are fairly obvious reasons why progress has been delayed, etc., predominantly due to the pandemic. So, for example, we haven't been able to do reach our target on face-to-face consultation because of that, but that hasn't stopped other, as we've just heard, with regards to the local plan and other issues, consultation taking place. But there are other areas that have also been impacted on. I'm mindful of the time, Chair, so I'm happy to take questions from members rather than going through the indicators one by one.
Right, any questions for Steve?
Could I ask a question, please?
Yes, Councillor Schuler.
Lynn. Steve, in the full corporate PI report, the gauge format type talks about aim to maximise or aim to minimise. Could you give me an idea what that means? Because it kind of means nothing in terms of we've got percentage targets and outturns, etc., and then maximise and minimise. It's not very clear how we would maximise or minimise, and it just makes no sense to me. It might just be because it's the format. Thank you.
No, this is something that has been put in actually to assist members after members' comments over a number of years regarding the performance indicators, because it does depend often with these indicators which ones you're looking at. So, you know, if, for example, we take the first one that tends to be there in the exception reports about data protection subject access requests, well, the target is we want to turn those round within the time scale 100% of the time. So we're always looking to maximise in that. In others, the indicator actually is to reduce the indicator, and that hence you're then seeking to lower it, and it depends on the nature of the target, and that's why it's been put in, because members sometimes weren't quite clear what the indicator was trying to achieve and in which direction of travel you were going to go. So in some things it's something that we're wanting to reduce, and other things it's something that we're wanting to maximise.
Thank you, Steve.
Thank you.
And any other questions? I've just got a comment, really. You know, for example, on page 62, and again, it may be related to COVID, we've got the residual household waste per household, and there's comments about the PI always being late because they've not got the data in there. I think that is getting worse. So, and it would be helpful if there was some explanation. And we did discuss this at pre-agenda, didn't we? So we are asking in future if we can have some sort of explanation of the trend. So generally we do get that, but we don't always get it in the commentary. Is that a fair comment, Steve?
Yes, I think you did raise it at pre-agenda meeting. I think Richard has taken it up with the Craig Taylor, who's the relevant head of service, who I think he has agreed that he'll look at the commentary that goes in there. There is always a lag on this, always has been, because of the time it takes to get the information reported back. And I believe it's something also that, you know, as a particular issue, was picked up in the scrutiny recycling review as well. Thank you, Chair.
Thank you. Thanks, sir.
Could I just make one other comment?
Yep.
Where we've had large delays in terms of the pandemic, would it not be better to reset the target dates, and or is that not compatible with the system or something like that? Or you know, it's not about fudging the issue. It's about putting a more realistic time frame in terms of what we're dealing with.
That's a fair question. Yeah.
Yeah, I think if it's a fair point, I think possibly with the benefit of hindsight, then we might have reconsidered that. But when we entered into the pandemic a year ago, it was at the onset of the new council year when we were setting targets. Clearly, none of us really appreciated just how long the pandemic was going to run for, or will continue to run for. You mentioned earlier, Cabinet considered the target setting report, which has been the opportunity for every manager to review the targets and put those forward. And in fact, actually, it's quite encouraging to report that officers are not seeing this really as a reason to actually seek a whole scale reduction of their targets, and in some cases officers are actually, and it's been agreed to actually up the targets. And I think we want to stay focused on those. Some of them are national targets and benchmarks that we have to have anyway, and I think it's far more important to actually understand the story behind the indicator than necessarily the indicator itself, and that's what we're really trying to get to. So yeah, I take the point that's been made, but I think at this stage we're colleagues have had the opportunity to review there now, and the indicators are largely going to stay the same, and it's for us to, as you as Scrutiny committee, to get behind the detail behind those indicators.
Thank you, Steve.
Thank you.
If there aren't any more questions, the recommendations are 6.1, that members note the contents of the report and appendices analysing our performance and council plan progress for Q3 2020/21, and 6.2, that members determine if any further action is required to address areas of performance that are currently off target. Is anyone against that course of action or wishing to abstain? No, thank you. That recommendation is carried. Next, we have 11B, Overview and Scrutiny Committee Work Programme, page 103 to 110. Can members please note that we have an extraordinary cabinet at 5:30 p.m. on the 7th of June 2021, and that's been called, and therefore this will be followed by an extraordinary Overview and Scrutiny Committee at 7 p.m. on the same evening. I will pass on to Richard now to outline the report and answer any questions.
Yes, thank you, Chair. Apologies, I'm audio only tonight, so I hope that you'll be able to hear me okay. In terms of this report, really, it's setting out some of the progress that the committee's made over the year. It hasn't been an easy year, and there's been a number of challenges in scrutinising issues in terms of through Microsoft Teams, etc., that we hadn't planned for. So in terms of the achievements, I've set some of those things out at paragraph 5.1 in the report. In terms of scrutiny reviews, the task and finish group looking at the issue of flood, that work is coming to a close. There's a few loose ends to just tie up, a few further avenues of investigation, and the hope is that the report will be brought to overview and scrutiny in the new municipal year. In terms of looking ahead then, there has been some impacts of COVID, and there's three strands really of items that will need to be carried over to the new municipal year. Those are the attendance by East Midlands Ambulance Service. We've received written reports from EMAS, but unfortunately due to COVID we weren't able to have them attend committee. The other strand is member training, in terms of a general overview and scrutiny training, but also covering aspects of scrutiny of finance. That wasn't able to be delivered as we'd intended this time around, so we'll roll that one over. And also as I've said, the report of the flooding task and finish group. But other than that, scrutiny has been able to continue, and we envisage that it will be able to continue in the future. In terms of priorities for the future, we'll be asking members and officers to submit items for consideration at scrutiny, and there'll be a shortlisting exercise based upon a criteria, and that criteria has been used for a number of years, together with performance information as well. So the committee will have that information together with suggestions from members and officers in terms of proposals for items that scrutiny may wish to consider looking at in further detail, and we'll be bringing a report to overview and scrutiny at the start of the municipal year. I don't know if anyone's got any questions, but that's the essence of the report, Chair.
Thank you, Richard. I'd just like to comment and thank you for that report, and thank all the officers involved and all the members on this committee, because it has been a successful year for scrutiny despite this terrible pandemic and extraordinary situations. I think it's been a flexible, effective response, and everybody's kind of stepped up in terms of getting used to virtual meetings and so on, and that's been really good in many ways. It's not perfect, but there's a debate going on at the moment, isn't there? An email responding to the chief exec's comments and whether we are going to be allowed to have virtual meetings going forward. But I hope we will, because as part of a range of sort of tools or methods that we can use in terms of scrutiny, I think it's been very good for task and finish groups, for example. So where it's awkward for members to maybe travel a long way for a meeting during the day. Yeah, so a successful year there. And just to reiterate what Richard said about encouraging members to submit their ideas for scrutiny topics in the coming year, and there will be an email going out about that. So any questions from anyone?
Chair, Councillor Challoner, it's just
David.
a comment, and obviously a big thanks to Richard and all the team that have done an exceptional job under the circumstances this last year. When he speaks about financial training, obviously at audit risk every November we have the Treasury Management training, which is like a mandatory thing. I know one or two people who are either subbing tonight or on this committee are part of the Audit Risk Committee, but I can't see why that hours training, whatever it is, isn't made open and available to members of the audit, of the overview and scrutiny. So could that be a possibility? And then it gives, because Treasury Management does come up to be scrutinised through the Overview and Scrutiny Committee. So there's possibility that there's the availability for people to attend that training session, what they do each year.
Thank you for that. Yeah, I think that's a good point. I'm sure it will be valuable. I think finance is probably one of those areas where members do feel that they could do with some more support in terms of, the whole budget process. Are there any further questions? Councillor Richardson, Maddie.
Yes, can I just make a comment, please, not a question? I just want to thank Richard and Liz and all the team for all the work they've done on the task and finish group in flooding, because it's not been easy. And we've had delays in people writing reports, and not under circumstances that certainly was, not a problem, because this is what's been happening. But I just want to say thank you for all the hard work they've done, and it was a pleasure to chair the meeting. Thank you, John.
Thank you, Eddie, and thank you for chairing that subgroup. And I think it is very credible that we've managed to do that despite everything else that's going on. Still look at the flooding, because there are other crises, potential problems, and we nearly had it again. But good progress I think is being made in terms of scrutiny in that group. And as you say, the delays are due to the COVID crisis affecting the officers who would have been involved. Are there any more questions? I can't see any. Okay, so the recommendations are 9.1, the committee agree the approach to the work programme as set out in the report. 9.2, the committee note the update from the flooding task and finish group. 9.3, members are advised to contact the policy and communications unit should they have any queries regarding future meetings. Is anyone against that course of action or wishing to abstain? No, thank you. Well, that recommendation is carried. And we now move to section B, items for discussion in private. Can I please confirm that in accordance with part 1, schedule 12A, the Local Government Act 1972, and after considering the public interest test as set out by the officer in the body of the report, members agree that the following items of business involve the likely disclosure of exempt information as defined in paragraphs 2 and 3, and therefore in accordance with section 100A of the Act, the press and public be excluded from the meeting. Is anyone not in favour of that course of action? No? Okay, thank you. At this point, I'm just going to ask the caster to stop the live streaming and confirm when that's happened.